We are happy to bring in with us again the chief of the West Bloomfield Fire Department, Chief Greg Flynn. We were just kind of talking off camera. You usually do the turkey trot. Chief, I'm a little disappointed if you don't have a turkey costume. I actually have two. I'll be happy to loan you one.
Yeah, well, I would be all in. We are definitely going to miss the turkey trot this year. It's a great way as a family to start, and then as a community, just to be downtown and running through the streets with thousands of people and the music blasting and just everybody cheering and high-fiving, all the things that we can't do anymore. It violates every COVID rule that's out there. So, I'm hoping to have the motivation to get up that morning and do a 5K just around the neighborhood. So.
Well, and a lot of people don't realize is that it actually supports a lot of good companies or a lot of good organizations. It's not just a fun time for everyone to get out there and celebrate and, be goofy and get out there and do a 5K run or walk. But they do help a lot of charities. So anyone that typically does it, Chief, if you and your family typically do it, you could still sign up virtually. So you can still get your medal. For me, when I do these races, it's all about the medal. Sure. Just, it's you need a little bragging rights. And so you could still do that and still support some of these charities and these organizations. And Chief, putting that aside, we just heard the news coming out yesterday. The Troy the Troy Fire Department had to shut down one of its firehouses due to an outbreak of COVID within the firehouse. How worried are you about that as we go into the second surge?
Worry wouldn't be a term that I would use, Ronnie. I would reframe that to say how prepared we are for when COVID strikes. So with the amount of community spread, we look all the way back to March when this started. We had 3 cases internally in the first few days of March. This was actually before there was real clarity that the virus had officially, if you will, arrived. And the same extended care facility that was the first case documented in West Bloomfield was the same place that our medics were in the day before. And we feel that through our contact tracing that's where our medics were most vulnerable. Nobody was hospitalized and all 3 medics recovered without issue. We've gone a long stretch since we've had another case, and that's because of the professionals and the plan that's in place of deconning the station, using our physical distancing, all the same things that our businesses are doing. That's where we're most vulnerable now, is that the workforce, our school teachers, the people that are actually executing in the workplace are the ones that are succumbing to the disease. And again, 80% of those folks still, I believe that number is still a relatively good number, are going to convalesce at home. They're going to have the generalized just malaise and weakness and flu-like symptoms. They're going to consult with their physician over the phone like we've been recommending since the get-go. And then they're going to return to work after they're feeling better. And we've experienced a little bit of that here at the FD, but our plan is in place. We're executing the plan, and there's been no interruption in service. I have no intentions of closing a fire station in West Bloomfield.
And Chief, knowing that rapid tests have really helped, and trying to help not just, police departments and fire departments across the country navigate these potential outbreaks, but also businesses as well. So are you utilizing rapid testing? And if so, how concerned are you with the accuracy of some of those rapid tests?
So we're using everything at our disposal with our healthcare professional colleagues. We may institute the rapid test as an initial indicator, but we're also following that with the more conclusive and more reliable nasal pharyngeal swab test. So we can take a test that we know is more reliable to be a false positive. Make sure I get that right. So more than likely, it's going to give us an indication that if the person is symptomatic and we get a positive test off of the rapid test, we're finding that the follow-up test, the nasopharyngeal swab, is also positive. What we're not seeing is if we have an asymptomatic firefighter that's been exposed that we're getting tested with the rapid test, we're not seeing a negative on the rapid test and a positive on the oropharyngeal swab test. So my point is that it's a good early indicator as to what our exposure and what the impact to the organization is going to be. But we do not rely solely on the rapid test. We know that it's vulnerable and it's lower reliability than the other testing available.
But what you were just stating and how you're utilizing seems to be a good indicator about how businesses should, utilize the test as well. Because we've all heard it back in the beginning, there was a lot of discussion about the accuracy of some of these tests. But it seems that one thing that's been good to come out of this, number one, is testing is getting better. And also just the number of test sites that are available. I mean, I remember back in the beginning, you were hard to even get a test, because they were so short on testing. As far as the supply chain, from your standpoint, does it look like you're going to run into those short testing supplies that we had in the beginning, or has that pretty much been addressed by now?
I think that the stakeholders on that end, on the supply chain, and those on the lab side of things have really gone to great lengths to support that to strengthen that supply chain. And again, that's globally. So everybody's going after these materials. And I think that the supply, the producers have ramped up production. So, don't quote me on that one. I'm not, intimately involved with that, but I'm not hearing the indications downstream that those problems are still existing. We're seeing testing results routinely, not 100%, but routinely, we're getting results back within 36 to 48 hours on the oropharyngeal swab. So that's nasopharyngeal swab. So that's what we want and where we want to be. So we're content with that. We always want it faster. We always want to know right now. And again, Ronnie, Tyler, look at where we were back in March. We're not even a year into this thing. And look at the innovation and the just overall increase in reliability of the testing. I mean, some people have done some really fantastic things. I just saw a commercial, I think it was for Costco, that they kind of have an at-home test kit or something that maybe you do your sample and it somehow goes through some testing and can get you some results. I don't think that's going to be too far away where if needed, businesses are going to have some of that capability. My son's at Michigan for his freshman year, and he has access to be able to go down and pretty much get a test anytime that he needs to.
Yeah, I think one of the great things that may come out of this, the collaboration that we're seeing within the medical field. Think about it, from the fact that we're less than a year into this, and we already have a potential of not one vaccine, but several vaccines. And I think had this not been a global crisis, we maybe wouldn't have seen that. It seems like some of these companies and businesses and countries are putting competition aside for the health of our country. And let's hope that that collaboration continues post-pandemic and with some of these other diseases that we continue to fight and continue to look for solutions to, such as various cancers and Alzheimer's, and the list goes on. So that's one of the good things. Chief, while we have you on here, today is Veterans Day. We had you out there earlier this week. I know that you went to the luncheon. Talk a little bit about the importance of hiring some of the men and women that have served our country, and in that military service. What does that bring to a community when you hire them on to the fire department?
Well, again, I want to express my sincere gratitude to all of our veterans. We have hired many veterans here. We celebrated the Marine Corps birthday yesterday. Both my dad and my brother are Marines, and I know that's a big day for them. But all of our veterans and the celebrations that are taking place today, on behalf of the West Bloomfield Fire Department, our sincere gratitude for their service. As for someone who has served in the military transitioning into a service within a municipality, within the fire department or police department, it is a very good transition. It's a smooth transition. They have this career of service to country, and we're going to take that and and distill it down just a little bit to service to community. And it's very applicable. The paramilitary organization provides a little bit more flexibility as many of these folks are starting to grow a family. And so sometimes military life might have a little bit more of a rigid type format, whereas working for a municipality, working for local government is going to provide more flexibility, but still a little bit of that paramilitary rank structure, things that many of us really like. I've really enjoyed my career in understanding a clear chain of command and who to talk to and who's your boss. And that makes for a good workplace environment for so many people.
So, Chief, if someone is out there listening right now, they're a member of the military about to get out. I do think the military does a pretty good job of trying to help transition some of their members out into the civilian sector. However, I know that when I was doing the recruiting for ATF, sometimes it was hard to get them to be able to put their experience that from the military into layman's terms. And even those conversations and those like one-on-one personal interviews. So if I'm someone who's in the military, I'm transitioning out, what advice would you give to them when it comes to trying to get hired on with a local department and how they can phrase their military experience into layman's terms so that a regular person can understand?
Well, I think when we have someone who has served in the military across the table when we're doing interviews, the thing that I'm looking for is really, you're right. Some of that may be difficult, especially someone who hasn't served in the military, to completely understand what that looks like. But here's what I do understand. I understand commitment. I understand core values. And I understand that that intrinsic drive to do well, whatever the job is in front of you, and what that commitment is to duty, the commitment to an organization and putting that organization above self. And those are those attributes that translate so very nicely into local government service from the military. And so while I remember my brother was a tank specialist, and he was a part of a unit that was a tank destroyer unit, a tow missile specialist. And as his younger brother, I loved hearing about that. And so some of it does translate over, but the details, you're right, can be very challenging for folks that aren't in it. Just like me starting to talk a lot about the fire service and different terms and the lingo that goes with it can be a little bit difficult to discern to someone that's not involved with it. So they do have a little bit of a challenge of bringing that terminology down. But the thing that we all can communicate with as a boss, as a guy that's going to hire somebody, I really am looking for those core values, what drives that individual. We can really take anybody with the right attitude and the right commitment and make them into a wonderful paramedic firefighter. It's very difficult to teach pride. It's very difficult to teach a real positive attitude and approach to life. But if you're coming to that already and the military has instilled that in you, that's something that we're going to see across that table and something that we're going to want to make part of our organization.
Well, Chief, it's always great having you with us here on the Oakland County MegaCast. Quickly, before we let you go and bring in the Chief from the Keiko Harbor Police Department, anything we didn't touch on that maybe you want to share with the listeners and the viewers right now?
Well, again, I just want to, and I know it sounds a little bit like a broken record, to just encourage people to keep up their commitment to stopping the spread of the novel coronavirus, that you're doing a good job, and let's not stop. And if our governor and the leadership within the legislators within Michigan or at a national level encourage us to wear our masks more often, to wear them out in public, let's embrace that and see what's positive about it, and really think of others around us. Not so much just focused on ourselves, but focused on others and the service to others. And together, along with this virus, the planning that we're doing as an emergency operations center, both at a local and county level, for distribution of the vaccine, All of that's going to come together, but you are part of the plan. Each and every one of us is part of that plan, and our team to execute that plan. And that plan, that execution is only as strong as its weakest link. And so please, please, please don't be that weak link.
I know, as much as you say it, we all still need those reminders because we can get a little too comfortable. It's like you said, how many months into this and people are feeling fatigue. But I think as we go into the winter months, it's going to be a stark reminder, as these latest numbers already are. So thank you so much. And Chief Greg Flynn with us here on the Oakland County MegaCast. Can you also just extend our gratitude to your family members for their service as well? We so appreciate it. Please let them know that they are thought of on this day and every day, and their sacrifice is much appreciated. Chief Greg Flynn with us on the Oakland County MegaCast.